My first name is Olivia, and I've been in recovery for 3 years now. A normal day was definitely really rough for me. It was waking up very late, either not feeding myself or feeding myself too much, no energy. I didn't have any joy hanging out with friends or hanging out with any of my family, and I just felt so much hopelessness, like my life was never gonna get better. I actually saw a psychiatrist a couple of years ago, and I explained to her my concerns about I want to get off of medication. I don't want to be on meds forever. Like, I'm tired of being depressed. I'm tired of being anxious. This is no way to live. And she told me, well, you're depressed. This is as best as life's going to get. And I thought, there is no way this is as good as life gets. And I would have plenty of friends and people I would know and see, and they just seemed so genuinely happy. And I'm like, I know it's possible. How do I get there? And I do have quite a lot of resiliency and determination. And so, I mean, if there's a will, there's a way. So I knew that I needed to get help, and reaching out for help is really difficult and it's hard to admit. And I definitely felt like very ashamed and embarrassed. And I mean, hindsight's 2020. I wish I would have gotten the help sooner, but nonetheless, I'm glad I got the help when I did. It was definitely really scary because you don't know people, you don't know what your day-to-day is, you don't know what you're gonna do. And I was very much just like a shell of a human being. And I was very scared. I didn't want to talk to anybody. But that fear was overcome really quickly, kind of once you meet the facilitators and the therapists and the medical staff and all the other patients there. It really, I wouldn't say makes you feel at home, but it definitely eases things for you a lot. I would probably say that we have an art room, which is funny because I picked up painting while I was in treatment, and now I come back as an alumni and I teach a lot of painting classes for some of the groups, and I find that a lot of fun. I think the structure was also really interesting to me, and I liked how our days were structured, so transitioning back into my normal life out of treatment was a lot easier. And I loved all of the psychoeducation that they taught to us, and they gave us so much knowledge on how to better prepare ourselves for moving out of this step of our treatment. Funny enough, I would probably say Kim when she was just working in intake. I'm not sure what she does now, but I would probably say Kim. And it's not like I see her every day. It's not like I have appointments with her or anything, but with my intake appointment, I felt a little more comfortable and a little bit more at ease because I felt like she was just so personable and relatable. And I felt like, oh, this person understands me and I don't feel like I'm being judged. And even though she wasn't somebody that I see every day, it's nice to get to see her in the hallway or stop by her office or like give her a fun update. And so she was definitely like one of my favorite people to see. No way! Oh my God. I love this for her. Yes. She does such good work. My life is completely different. To try and compare it, I, at the time, was in a very horrible, toxic marriage that I didn't realize was also kind of leading to the detriment of my mental health. And I wasn't working, I was unemployed for 2 years, and I just thought, there's no way life is gonna keep going on. I'm never gonna recover from this. I'm never going to get the job. I'm never gonna start making money again. I'm never gonna get healthy. And I think now I'm in such a good place. Like, I have a great job, it's full-time remote, I make good money, I'm moving back to LA soon so that way I can go be with my family, closer to my new partner and closer to some of my friends to be able to continue to build out my support system while I stay in remission. And I'm definitely happy that I went to treatment because the period of my life during that time was so hard. I never thought I was gonna come out of the other side, but now I know I'm equipped and I have the tools to continue to keep progressing. But I also do recognize that if something does happen in my life or I get derailed or I relapse back into my mental illness of depression and anxiety, that I have the resources, I know where to come, I know what works for me. And so yeah, my life is definitely very different now, for the positive. I feel like this is kind of cliche, but just like waking up in the morning, like waking up in the morning and actually being happy that I woke up and like having energy and want to get out of bed and want to do things. Because I remember I was sleeping like 16 hours a day. I wasn't eating, or I was eating too much. And I would try and live a normal life of, I'm gonna get up and shower and go to the gym and I'm gonna cook and see friends. But it was every time I did something to make me feel normal, I would just feel so miserable still. And so I would constantly think like, there's a disconnect somewhere, like what is going on? Because I have all these great things in my life, but I'm still not feeling like myself. And so just the small things, honestly. I remember at first I was like really embarrassed to tell my family because I didn't want them to know that I'm really not doing well. I need some extra help. The help that I need is kind of beyond the scope of just having therapy once a week. But once I realized that I don't need to hide behind a mask or anything anymore, and kind of like let my family in on what I was experiencing, it definitely helped with my support system, and it helped with me getting a lot better. I always tell people, try everything once and try it all the way through. If you hate it, you never have to come back. And if it doesn't work for you, it doesn't work for you. But I personally didn't know that PHP and IOP was even an option for mental health treatment. It's not really talked about by schools. A lot of doctors don't bring it up to you. And so I definitely would just tell people, just try it once. And like I said, if you hate it, you don't have to do it again. But I think once you get into the swing of things with all of the activities and the things you learn and kind of the relationships you build with all the other clients here and hearing other people's story, it really changes something for you. But I think continuing to go and having the perseverance to commit to yourself to want to get better would be the best thing to do. That's so interesting. I think finding someone that you can confide in, and I know a lot of the times people are scared when they don't have the information, but honestly, my best advice is just start Googling. Get online, start asking questions, especially in the day and age of AI. You can find out a lot more information. If it's, where can I find treatment centers? How do I know if this is right for me? What kind of results do people get out of doing these programs? And just to ask questions, because I know a lot of people are afraid. And so if you can find either someone or something that you can confide in to at least start your search, I think that's probably the best way to go. One sentence, that's so hard. Best part of my day. That's so interesting. I think recovery for me today would definitely mean a lot of the perseverance and being able to recognize that I not only went through a really difficult part in my life, but I was able to come out on the other side and come out stronger. Not to say that I'm never going to be depressed for the rest of my life, or I'm never going to experience another catastrophic event, but if I do, then I know I have things to land back on, or I have a program that I can go back to that I know works for me. Wow, we did great. Thanks, guys.